All blood contains the same basic components: red cells, white cells, platelets, and plasma. It all looks pretty much the same to the naked eye.
Not everyone has the same types of markers on the surface of their red blood cells. These markers are also called antigens. Antigens are proteins and sugars that our bodies use to identify the blood cells as belonging in our own system.
There are 4 types of blood: A, AB, B, and O. You could have a positive or negative following it. AB negative is the rarest type of blood, while group O is the most common type of blood. O negative is the universal donor, which means that anyone, no matter what type of blood you have, can receive it. But people with O negative blood can only receive O negative blood if they were in need of a transfusion.
There is a way to determine what type of blood you have. It's a safe procedure, but it should definitely be done under sterile circumstances. After you've found a finger you'd like to use for a sample of blood, use that blood to put in a tube or a tray with a drop of reagents that contain the A, B, and RH. The reagents contain the antibodies for A, B, and RH that determine the blood type.
After the blood is mixed with the reagents, look for clumping of the blood cells.
The blood typing markers are microscopic, but are very crucial when it comes to getting blood. If someone would happen to receive the wrong blood type, their body could reject it and become very, very sick.
The RH factor is very critical to the blood typing process as well, as it determines if the blood is positive or negative. RH is protein that is inherited. This breaks the 4 original categories into further categories. If a blood type has an RH factor, that makes the blood positive, and if no RH factor is present, the blood is negative.
The 8 types of blood and the RH factors are O negative, no A or B markers, and no RH factor. O positive, no A or B markers, but it does have an RH factor. A negative, this has an A marker. A positive has an A marker and an RH factor. B negative has only a B marker. B positive has a B marker and an RH factor. AB negative has both A and B markers. And AB positive has all 3 factors: an A marker, a B marker, and an RH factor.
Again, it is important to know the blood type for future situations of donating blood or receiving it. In the case of an emergency blood transfusion, doctors must be able to think fast and know their facts of which blood type is compatible with their patient's blood to ensure a safe blood transfusion.
In some cases, incompatibility is a problem with a blood transfusion. There can be an occurrence of a hemolytic transfusion reaction. Basically, the person's immune system decides to destroy the blood cells that were donated through the transfusion.
Okay, so why exactly does this happen?
Well, like I talked about before, blood clearly has 4 different types: A, B, AB, and O, but sometimes a small error could lead to a wrong labeled blood, and that could lead to a massive reaction in the body.
Hemolytic transfusion reaction is a common occurrence when someone gets the wrong blood transfusion into their body. The body will start to go against itself as the original white blood cells start to attack the new red blood cells.
Hemolytic transfusion reaction is an allergic reaction in a way. Someone isn't supposed to have something in their body, and the body reacts in a way to get it out of their system as soon as possible. Some symptoms of a hemolytic transfusion reaction are a burning sensation, chills, fever, pain in your back and flanks.
Since some people notice symptoms sooner than others, they can try to stop the transfusion and get the right blood going. Others are not so lucky. Some people who have experienced a hemolytic reaction have gotten acute kidney failure, anemia, pulmonary edema, and shock.
Shock is a life-threatening condition that can come from an inadequate blood flow. Anemia is where there aren't that many healthy red blood cells present, and pulmonary edema is where there is excess fluid filling the lungs.
So what happens when the body gets the correct blood type?
When the donor blood is mixed into the body within a transfusion, the donor's DNA will be present in the body for some days, but it is likely minimized because the majority of the blood is red cells.
The real risk from a blood transfusion is the body's reaction to the strange blood. Allergic reaction, fever, and an overload of iron in the body, or a serious but rare condition in which the white blood cells of the donor blood attack the bone marrow.
This is why during a transfusion, nurses will make sure the person feels okay. They keep an eye on the person's temperature and blood pressure. The nurse also looks to make sure there is no rash or any signs of an allergic reaction.
In almost every situation, the benefits of having a blood transfusion far outweigh the risks. Since many blood transfusions are given due to severe blood loss, a severe infection, anemia, liver or kidney diseases, or given with some forms of cancer treatment, it is better to receive a blood transfusion than have the blood try to heal itself.
There is a far more severe reaction to the wrong blood transfusion. The reaction is called intravascular hemolysis and gives the most life-threatening reaction.
Intravascular hemolysis is where the recipient's antibodies begin to attack and destroy the donor's red blood cells while the cells are still in the vessels. The donor's blood starts to coagulate in the vessels, meaning it forms clots within the vessels. If vessels have clots in them, that would mean that there wouldn't be proper blood flow to certain parts of the body depending on where the clot forms.
The symptoms of intravascular hemolysis are excessive hemoglobin release, urine that is bloody or brown, accumulation of bilirubin in the blood causing jaundice, yellow of the skin or eyes, shock to the body, and uncontrollable clotting throughout the body.
Why would this happen in the first place? How could someone get the wrong blood transfused into them?
This mainly happens due to human error. When someone is filling out the sheet at the donation site, they may not know their blood type and fill in the wrong one. Mislabeled blood is also an error that could be a possibility for the wrong transfusion.
Probably one of the biggest ways a blood type is transfused incorrectly is failure to check for a condition existing in the donor beforehand. But, fortunately, wrong blood type transfusion happens very rarely. Out of 1 million units transfused, 4 are transfused incorrectly.